gateway to rest of the body, including this includes viral and dental problems. So, oral bacteria and gum diseases take a toll on our health in the form of cardiovascular diseases, birth complications, stroke, pneumonia, and whatnot. Mouth is in a bubble by itself, so it's no big surprise that poor oral health affects overall well-being. Therefore, maintaining the proper dental treatment is of utmost importance during COVID-19, especially during pandemic, where being healthy is of utmost importance. How can you expect yourself to be completely healthy if your oral health is at stake because you restrain yourself from your dental appointments? Don't you think so? Let's take an example of having a cavity. Let's take if you have a cavity. A simple filling can fix this cavity, but what happens if you delay it? It worsens and you end up having an expensive treatment which you could have avoided if you have gone for filling in the first place, isn't it? And what about a plaque? It's a bacteria-laden film that surrounds your teeth and gets hardened with time. So if it is not removed on regular basis, it leads to inflammation and in turn leads to gum bleeding and potential loss of teeth. Why risking your life with this? Oh, the only prevention is treatment, so don't pause your prevention. Now, your health and safety is of paramount to the doctor, so feel safe to visit a dental clinic during COVID-19. The dental problems have to be requires expert medical treatments. So a small problem today can be of emergency tomorrow. So talk to your dentist on time and stay safe. Thank you.
Good morning, everyone. It is fair to say that the routine dental checkups and treatment have come to a halt since the past year, and the question arises, is dental treatment safe at this point of time? In a general way, yes it is. There are several protocols implemented to make sure that treatments are given with complete efficacy while keeping the safety of the patient and the dentist in mind. But this does not mean that you step out of the house and go to a clinic for every minor thing. No, not at all. The fight against COVID is not over yet, and you cannot neglect your oral and dental health either. So, what can you do? The answer to that question is teledentistry. Fix an appointment with your dentist for an online consultation or video conference. Share pictures of your oral cavity if needed. Discuss your medical and dental history with him, and let them decide if you need any immediate treatment or can it wait till a better date comes depending on the situation in the area of the country you're living in. Do follow an appointment schedule if you are asked to visit the clinic, because what that will do is it will help in keeping the crowd minimal in the waiting area. Any symptoms like the fever, cough, chills, cold, or anything like that, you should inform your dentist about it. Now, whatever I'm saying, all this might sound very scary and you might not want to talk to a dentist at all unless you have excruciating pain in your mouth. So let me show you what will happen or what can happen if you neglect your oral health. So as you can see, these are a good set of teeth. Now, if you don't take care of them, then there will be tooth decay and then you will have to get them filled. Now, composites are used nowadays which are tooth colored material, but let me tell you that nothing is as good as natural tooth material itself. Now, if you do not get them treated, the lesion will go on and it will need root canal treatment. And after root canal treatment, the dentist will again take a layer of your tooth out and then give you a crown on that, which comes with its own set of problems. If you do not take care of your oral hygiene, there can also be germ accumulation leading to bad breath, inflammation of gums, bleeding gums, and sometimes it can lead to tooth loss. The tooth is gone. You'll have to replace it with artificial dentures, implants, which will cost you 5 times, 10 times the patience, the effort, the money that it would have cost to just get a simple filling or cleaning done. So basically, good oral health is very, very important to prevent a lot of diseases, may it be bacterial, fungal, viral, the list just goes on. Simple oral hygiene measures could help reduce the risk of transmission of the coronavirus from the mouth into our lungs and decreases the severity of COVID 19. With that said, I expect each and every one of you to follow some simple oral hygiene instructions. Number one, brush twice a day with toothpaste, 2 minutes every time. Never ever ever share your toothbrush. After each use, try to clean and disinfect the toothbrush by dipping it in antiseptic mouthwash. If you have a family, avoid using a common toothbrush holder. You must change the toothbrush after 3 months of use. Use disposable interdental cleaning aids if you can. Disinfect the floss containers and the holders regularly. Because remember, our oral cavity is the gateway to our complete health. Avoid going out unless completely necessary. Wear your mask properly, it should be above the nose. Avoid going into crowded areas. Maintain proper social distancing. Sanitize or wash your hands at regular intervals. And when the chance comes, please get vaccinated. It is safe. Thank you for listening.
Hello everyone, dear patients. I'm just preparing this video because we know that southern current situation is very difficult. Like this pandemic is arise, COVID-19 is there. There are so many other problems. Day-to-day survival is very problematic. Plus, to add this, if suppose you have any kind of dental pain or dental issue is there, it is very unbearable. And in such case situation, what to do, what not to do is very dilemma in our mind, because this COVID-19 is mainly related to our oral cavity. And here a threat, so many dentists during the first wave during the first lockdown, they have shut down their clinics. Also, they close their clinics because of this kind of threat. Now, what to do, what not to do, I will just ask you to follow following guidelines. That will be definitely helpful for you. What exactly you are going to do in dental pain. So, whenever you feel that there is small amount of pain but bearable, please do not avoid that pain, or do not just get consult from your dentist. You can have online consultation. Nowadays dentists are available on WhatsApp also. They have shared their WhatsApp number, so just consult them. If he or she dentist asks to visit their clinic, please make sure fix a proper appointment and then only visit that clinic. But in any case I'm telling you, do not apply any homemade remedies or such kind of issues like applying balm from outside, putting something inside like Ayurvedic remedies. There are so many things available on Google. Please do not that thing, because that will definitely worsen the condition and definitely takes you or leads to you in the dental clinic. Also, while visiting a dental clinic, make sure or please have eye on your surrounding. If you come under the red zone, I request you not to or try to avoid dental clinic unless until it is very severe, and make sure you are going to attend in proper prior appointment. Also, it was noticed that during this lockdown condition, so many patients are thinking that okay, chalo, we have time, so we can get done our dental treatment whichever pending before. Please do not do. Their lockdown is present in your city or in your district just to avoid the spread of the cases. So if the higher cases are there, try to avoid aesthetic treatment which are not required during this time. In dental point of view or dental, there are very important treatments are which are actually the symptoms relieving, that is the pain or swelling, or if you think some kind of lesions are there and you are very afraid of those lesions, please make sure you are going to consult your dentist. Also, I will suggest you not to go under the treatment which are aesthetic point of concern. Also, if you are a medico-compromised patient, medico-compromised means blood pressure, diabetes, or you are having antiplatelet issue or any chest problem like asthma and all these things, I suggest you just take online consultation from your dentist. Also take a consultation from your physician. Make sure that you will relieve your temper. Only in necessary condition with both the consent and your proper condition of your physique, then only undergo. But try to avoid invasive procedures. Okay, that is very important. I have seen so many patients are eager to do implant and all. No problem if your area is out of the red zone and it is the working fine properly. Nowadays, dentists are doing the treatment by appointments only. So make sure that there is a gap between two patients and they are maintaining all the sterilization norms and all. That will be better for you. And obviously, you have to follow all the norms given by government. That is the keeping social distancing, wearing proper mask, as well as getting shot. That is the vaccination. Okay. So prevention is better than cure. I suggest you go under do proper brushing. Do not avoid brushing. Also try to have diet control. Raw food you can have, junk food as well as the food which may cause a severe tooth pain like a non-veg diet. I've seen so many non-vegetarian diet. If you have cavity and eat that kind of diet like chicken and all or fish, definitely you may get the things. So do not use stick or toothpick that may get infected your tooth. So I request you stay healthy, stay at home, and definitely get consult from dentist if required. You can contact on my number also. Thank you.
Good evening, Phoenix 2021. We are approaching the last stretch of this conference, and this is an immensely exciting evening for IAPHD Kerala chapter. We had an overwhelming response with actively growing participation of both students and faculty from different colleges, both near and far, with an epic number of over 4,000 registrations, 16 guest speakers, and numerous contestants. We gratefully acknowledge your involvement and support throughout the program and consider this as a commendation for our efforts. Today, the formal valedictory ceremony will commence at 5 p.m. And this 1 hour, we will have a warm-up session with surprise announcements and dazzling glimpses from the conference. So keep listening, keep watching, stay tuned, and don't miss it. From our humble beginnings in 2011, IAPHD Kerala chapter has evolved into an organization that has made its mark on the national and international arena of public health. Let's have a peek into the journey of IAPHD Kerala chapter in the past 10 years. our conference for 7 long days with an array of events with cerebral drilling and a creative palette, presenting before you the kaleidoscope with glimpses of all events of Phoenix 2021, all in a nutshell. Here we are with the entire team, the experts and architects behind the happening of Phoenix 2021, an epic event in the history of IAPHD Kerala chapter. Participating is sometimes more important than winning. It makes you a better winner for the next time. The moment that you all were waiting for has finally arrived, starting with the list of events and results. The price of success is hard work, dedication to the job at hand, and the determination, whether we win or lose, we have applied the best of ourselves to the task at hand. Now we have the results of the much coveted IAPHD awards for excellence in the field of public health. Over to the video consolidated by Dr. Shanavas for a quick glance of the winners in this category.
Dear doctors, before we go into the results of the most awaited IAPHD awards, let's have a quick look at the remaining results also. First, we have the troll competition under the topic Your Dental College Memories. The competition in charge for the same was Dr. Siraj. And now let's have a quick view at the entries that had come in.
A warm greetings to one and all. COVID-19 is an ongoing global pandemic caused by severe acute respiratory syndrome coronavirus 2 known as SARS-CoV-2. Till date, more than 177 million cases have been reported with more than 3.85 million confirmed deaths, making it one of the deadliest pandemic in human history. The world is struggling hard in overcoming this, and all medical practitioners, including dentists, are exercising caution in order to keep the transmission of coronavirus at bay. In the control of pandemic, the roles a public health dentist can play are many. We all are aware about how the dentists prove their marked efficiency in swab collection procedures. They work hand in hand with other medical professionals in screening and treating patients at first-line treatment centers. Some other contributions include providing first aid, recording vital readings, and data entry. The psychological support provided by public health dentists in spreading awareness and counseling patients on management of stress during this pandemic is indispensable. In this era of developed technologies, the social media platforms can very well be utilized in spreading awareness and importance of oral hygiene, including preventive measures. It is a need of hour that equal importance be given to the pre- and post-COVID patients regarding the oral manifestations of mucormycosis or black fungus infections and requirements in maintaining oral hygiene in them. The role of public health dentists is so vast that they play major roles in tracking the spread of disease, developing models, and even conducting surveys that helps in recording the statistics of both mental and physical state of affected individuals. These records can then be handed over to local government bodies for further analysis and planning. The public health dentist can also do epidemiological studies, biostatics, vaccinology and immunology, program planning and evaluation, and even consultation with telemedicines. In addition to this, the crucial role that can be played by public health dentists is in creating awareness among school children in maintaining their oral health, which can evoke interest and curiosity in them, will surely help us overcome the upcoming third wave of this pandemic, which is predicted to affect the children most. While this COVID-19 pandemic continues to affect the global community, the public health dentists can start to look towards the future outbreaks and can plan effectively. This novel coronavirus has also opened wide platforms of opportunity in researchers, including salivary proteomics and others. It is always said that prevention is better than cure. The public health is a most vital intervention in reducing the number of cases and also to lessen the burden of healthcare system. So during this pandemic, we can remind the people how important public health dentistry is in dealing with large-scale and global issues. And to conclude, the importance of awareness on following steps even after vaccination, such as wearing masks, physical distancing, and practicing proper hygiene will remain critical in preventing the spread of COVID-19. Let's unitedly work together in this and just stay healthy and safe. Thank you.
Good morning, everyone. Role of public health dentist in COVID-19 pandemic. The novel coronavirus has emerged into a global pandemic in a span of just 3 months from the first case reported at Wuhan, China. Right now, just before my elocution, the total number of cases as per Worldometer record is 17,89,39,856 and the total death is 38,74,879. In 2020, New York Times published an article with the title, "The Workers Who Face Greatest Coronavirus Risk." It was just about us, the dentist. But we can do a lot of things during this pandemic time. We all know the harsh lockdown and the stressful environment has created a very stressful mind for many of the people. And we know that these kind of things can lead to a very poor oral health. So it's the best time to educate people about how to care their oral health. It can be done by using any virtual platform or by making some small short films and circulating via television or any other social media platform. We can identify credible scientific literatures and can convert into the common man or a layman terms that every people can understand. Teledentistry can be utilized this time, but make sure the privacy or secrecy of the patients are well maintained while using these virtual media platforms. Mobile dental vans can be made available for the people who are in the vulnerable risk for this COVID-19. The people with the age of less than 10 and greater than 60. We also have a great opportunity for doing a tobacco counseling, as the lockdown has cut the tobacco and the cigarette intake of many of the people. But at this time, we can do a one-to-one personalized tobacco counseling, but make sure you do the follow-up too. And it's a time we can go hand in hand with the frontline workers. As professionally, we may differ from them, but still, the basics we studied from the college are in the field of anatomy, physiology, biochemistry, microbiology, etc., can help us to do that too. So we too can do a lot of things. This time we'll also fly, and let all hope for a better tomorrow, and do your best at this time and do what you can today. Thank you. Thank you very much.
Good morning, everyone. I'm Dr. Navami Ashok, Senior Lecturer from Anu Dental College. I'm here to speak about the topic, the role of public health dentists during COVID times. We all know that the dentistry is facing its one of the darkest times due to the spread of the pandemic, and we are all in a situation we have never been prepared for. So we are in a dilemma of what the future holds for us. So what I would suggest is that let us be prepared. Let ourselves be prepared, and let's get the community prepared to be in a situation where epidemics mean pandemics and become a part of our life. So a few new fronts where we can explore is, let us explore the virtual platform better. We can use it for creating awareness for tobacco counseling, and also we can conduct virtual camps. Why not? If conferences can happen at such large scale, we can definitely go for virtual camps. And also, we can need to utilize our dental vans better in the departments. It can be really useful for bringing out the vulnerable population who are unable to reach us during this time. It is a very nice time for us to reorient the dental services to preventive approach. We are all about preventive dentistry, isn't it? So this is a good time to give emphasis on preventive dentistry. And other things what we can do is we can work frontline with the medical staff. We can support them by telephone triaging, working in field work, and data collection, or medical distribution, and so on. We have so many opportunities there too. And not to mention the research field. It is vast, and we have a lot of topics where we can do a research on now. A few where I can mention about is we can explore the viral binding sites in the mouth. We can explore about the pre-COVID symptoms and the post-COVID symptoms too. Along with that, we can also look forward for quality evidence to promote quality literature during this time. That's really the need of the hour. We can talk about extended PPE use, and also surveillance about the oral effects with respect to the pandemic situation. And other things what we can do is aerosol management. We can look for better workforce models. So there are so many opportunities out there where we just need to explore and innovate. So what I would tell everybody out there as public health dentists is, let us not be pessimistic in this situation. Let us be opportunistic and optimistic, because that's the only way we as public health dentists can evolve. Thank you.
Sorry for the hiccups of the virtual platform. Now we have the results of the much coveted IAPHD Awards. Awards for excellence in the field of public health. Over to the video consolidated by Dr. Shanavas, Assistant General Manager at DM WIMS Medical College and Astra MIMS Wayanad, for a quick glance of the winners in this category.
Welcome guys, this is Dr. Shanavas here and once again with awards. Here it goes. Category 7, Innovative PG Activity. The award goes to Dr. Lakshmi Krishna, Tagore Dental College, Ratinamangalam, Tamil Nadu. Dr. Lakshmi Krishna developed an ingenious concept by developing a modified dental chair to accommodate both wheelchair-bound patients and general patients. And Dr. Lakshmi Krishna received a patency for this beautiful concept. Not only that, this chair, disabled aided dental chair, received an Oral Care Innovator Award by AIMS in recognition to its innovation, efficiency, and cost effectiveness. Category 8, Best PG Research Paper. And the award goes to Dr. Mallika Venkat, 3rd MDS PG student, Amrita School of Dentistry, Kochi. Dr. Mallika Venkat has done a compelling research on mass media coverage in health and oral health related advertisements. Category 9, Highest marks secured by final year BDS students in Public Health Dentistry 2019 and 2020. And the award goes to Aliya Samad, Patrantitta, Kerala, and Varsha Merin Babu, Changanasheri, Kerala. Category 10, Best COVID-19 Program in UG College. The award winner is PM Nadagowda Memorial Dental College and Hospital, Bagalkot, Karnataka. And Best COVID-19 Program in PG College, award goes to AMC Dental College and Hospital, Ahmedabad, Gujarat. Category 12, Best Online Program During the Pandemic. And the award goes to Dr. Imran Pasha Mohammed, Yenapaya Dental College, Mangalore.
Good evening, doctors. Let us now see the results of the Health Education Talk competition. We had received 348 entries. And here are the results.
Presenting before you the kaleidoscope, glimpses of all events of Phoenix 2021 in a nutshell, once again, all for you. Excellencies, dignitaries, delegates, and stakeholders. Good evening, one and all. I, Dr. Rajni George, on behalf of IAPHD Kerala chapter, take this opportunity to welcome each one of you to this valedictory function. Here we are in the last lap of the 1 week long conference hosted by IAPHD Kerala chapter and co-powered by Online Dentistry. Being on the virtual platform and with COVID sweeping across the nation, it was never expected to have this sort of a colossal response from within the country and abroad, with more than 4,000 registrations, national and international guest speakers, and active participation from umpteen number of contestants in all the events. We hope you all enjoyed the conference as much as we loved organizing it for you. It is our undying tradition to invoke blessings from God Almighty before any auspicious event. So let us begin with a prayer song.
Asato ma sadgamaya tamaso ma jyotirgamaya mrityorma mrutangamaya Om Shanti Shanti Shanti.
Words of welcome fill an occasion with warmth. I request Dr. Susan Thomas to officially welcome the August audience. Dr. Susan is the Vice President of IAPHD Kerala chapter and Professor and Head of Department at GDC Kottayam. She is a profound scholar, a guiding light, and an inspiration to all the ladies in this field. She deserves all the credit of being She deserves all the credit of being boldly instrumental in commencing post-graduation course in public health dentistry at GDC Kottayam. It is noteworthy that this is the one and only dental college under the umbrella of Kerala University of Health Sciences offering post-graduation in our specialty. Over to you, ma'am. Dr. Susan Thomas, ma'am.
Hello, can you hear me?
Yes,
Yes, ma'am, you're audible.
Okay,
Yes.
fine.
Yes, ma'am.
Sorry to interrupt, ma'am. There's a technical glitch happening here. Ma'am, your audio is not unmuted. Please unmute yourself by clicking on the pop-up that is coming up. Yes, thank you, ma'am.
Okay, fine. Sorry, I'll start again. Good evening to all our delegates. Greetings from the organizing committee of the National Conference Phoenix 2021 IAPHD Kerala chapter. Respected dignitaries on and off this virtual dais, dear friends and students. It's a great pleasure to have you all here to attend the last day of the Phoenix 2021. It is 10 years since IAPHD Kerala chapter was formed. This year, during the pandemic, we were able to conduct this national conference by the name Phoenix 2021. Dr. C.V. Puliyat, President of IAPHD Kerala, was instrumental in organizing such a mega event where more than 4,000 registered delegates could virtually meet. His strong leadership and motivation resulted in a robust teamwork. On behalf of the organizing committee of the conference, I welcome Dr. C.V. Puliyat. This conference, I am sure, has enriched the knowledge of all the participants through various activities and healthy competitions. Previously, to attend a national conference, we need to plan at least 2 months ahead. The use of virtual platforms during this pandemic has helped us sustain the dental education programs. Thanks to the digital technology, a large number of delegates could participate. Today, we have our respected Vice Chancellor of Kerala University of Health Sciences, Dr. Mohanan Kunnamel, as the chief guest of this function. Thank you, sir, for accepting our invitation, and we are privileged to have you. On behalf of the organizing committee, we extend our warm welcome. Our keynote speaker, Dr. Sriram Venkatraman, Additional Health Secretary, Government of Kerala, and MPH from Harvard University, has accepted our invitation. We look forward to his insightful suggestions in developing public health dentistry in Kerala. On behalf of the organizing committee, we extend a warm welcome. The first day of the conference was inaugurated by the IAPHD President, Dr. Pushpanjali. Today, the last day, we have with us our Honorary Secretary of the Association, Dr. Vamshi Krishna Reddy, is our guest of honor. We appreciate your continuum of support. On behalf of the organizing committee, we welcome you, Dr. Vamshi. A special mention of other dignitaries who are gracing this occasion is the President of the World Medical Association, Dr. Fuad S. Utunsu, Dr. Bivin Gopal, who is the Nodal Officer of the Non-Communicable Disease Control Program, Kerala, and Dr. Simon Morris, Deputy Director of Dental and the Directorate of Health Services, Kerala. And we have online Dr. Dibu Jacob Matthews, he is the Secretary of the Indian Dental Association, Kerala State. On behalf of the committee, we extend our warm welcome. The past few days of the conference had amazing involvement of the participants, that is, the members of the staff, IDA, postgraduate students, interns, undergraduate students at the state level, national level, and international level. Their presence and participation was a great strength for this conference. The organizing committee welcomes all our participants. The collaboration of the stakeholders, such as online dentistry team, and the support of the social media was remarkable. We extend our warm welcome. To conclude, the success of this conference has shown us the possibility of increasing the reach of medical education through communication technologies. However, this pandemic, we need to be with the people who have suffered and those who have sacrificed their lives. Stay safe and stay healthy. Thank you. Over to you, Ranjini.
Thank you, ma'am, for the cordial welcome address. Everything that was ever created was once visualized as an idea in someone's mind. Phoenix 2021 is the brainchild of our president, IAPHD Kerala chapter, Dr. C.V. Puliyat, a seasoned orator, passionate academician, social worker, counselor, professor and HOD at Malabar Dental College. And that's not all. He can adapt himself to suit any situation with great ease and perfection. May I now invite the Talaivar of our specialty, C.V. Puliyat, to deliver the presidential address.
Thank you, Dr. Rajini. அன்பாக பேசு, இனிமையாக பேசு, நன்மையை பேசு, உண்மையை பேசு, சிரித்து பேசு, சிந்தித்து பேசு, சபை அறிந்து பேசு, சமயம் அறிந்து பேசு. Good evening, one and all. Galaxy of dignitaries attending this session and my dear colleagues. A great evening to one and all. Indian Association of Public Dentistry Kerala chapter is celebrating its 10th year of existence with this wonderful extravaganza of online conferences where we were able to prove that it is possible that fun together with learning is possible. Thank you very much for signing in. During our inaugural session, we had around 900 people online and around 400 people on YouTube. This time it is reverse. We have around 800 people in YouTube and around 400 people online. But still, thank you very much for coming in great numbers. I really appreciate the enthusiasm of all the participants in contesting and participating in all the contests and giving up your contribution. The scientific session, 16 expert guest speakers attended the session, which was utilized by around 272 participants average in each session out of 4,200. Still, it is a big number that I suppose. Dear friends, in dentistry, there are 9 specialities, and many common public think that what is the need or what was the need of this 9th speciality? Maybe pedo for managing kids, proso for replacing teeth, surgery for doing surgical treatments, perio for managing the periodontal tissues, and so on. So for the common public or even a fresh dentist, it may be a dilemma that what is the need of this speciality? Our speciality deals with biostatistics and research methodology and preventive dentistry, together with the principles of administration and epidemiological studies. Public health dentistry is not only related to dental sciences, but also related to public health. In person, I disagree with the term dentist to be called for a BDS graduate, because basically we are stomatologists who not only deals with teeth, but also with the whole oral cavity. This conference has enlightened the importance of the role of dentists in public health, especially where there is the presence of our respected Vice Chancellor of Kerala University of Health Sciences and our Additional Secretary of Health Department, Dr. Sriram Venkatraman, and many other dignitaries. Let me once again highlight this aspect that we being public dentists have a valid role not only in school dental program or health education, but also in tobacco control, as well as palliative care, as well as neonatal care. Around 3,500 dentists from Kerala has volunteered themselves for swab taking procedure all over Kerala during this COVID time. So the specialty has to grow ahead together with considering all the other aspects of the field of health. It is indeed amazing that the whole medicine field is in one side and dentistry is in other side. You need a basic degree of MBBS to be a specialist, but why dentists are direct specialists? Because they deal with 32 teeth which have 32 anatomy and so much of complicated instruments, equipments and materials. We being in this field for past around more than 5,000 years, right from the period of Sustruda and Charaga. The first dental college being established in the year 1840 and in India in 1920, our field has grown to such an extent that we are ready to cater the public, the general public, in whatever way they need. Once again, I take the opportunity to greet you all. Let me share a few slides with you, whereby I can tell you a little bit about this conference. This conference had a wonderful registration of 4,299 right from the day 1 to day 9. Out of which, let me show you the statistics, which had general graduates, BDS students, which had postgraduate students, which had private practitioners, and which had public health dental specialists. This slide will highlight the participation wise pie diagram, which will show you where the participation for this conference was immense. In this COVID period, when people can sit at their house and enjoy the conference in full extent, that is indeed great. And being the president of Indian Association of Public Health Dentistry, We are moving ahead. This slide shows you the distribution of the delegates, and the next slide will show you regarding our plan of action. We are moving ahead with this 6 plan of action, out of which 4 you can see on the screen. We are going to have a family get together. We are going to come out with our directory, bulletin and journal, and we are going to have further activities in our association. Dear friends, in the next slide, you can see the next 2 activity, which will wind up by 2022 February, where I will step down from the post of President of IAPHD Kerala, and a new team of office bearers will take in charge. So this is an ongoing process. Not a person matters, but an association and the teamwork matters. Once again, I take this opportunity to thank each and every one in IAPHD Kerala, especially the organizing committee, my team of EC members, for making this program a grand success. Thank you once again. Goodbye.
Thank you, sir, for the thought-provoking address. It is my proud privilege to invite our chief guest for today, the Vice Chancellor of Kerala University of Health Sciences, Dr. Mohan Kundamal, a man of many accolades. He has a track record of holding prestigious positions from a very young age. Dr. Mohan has served as professor in the Department of Radiodiagnosis at Thrissur Medical College, as principal at Manjeri Government Medical College, and as head of Department of Radiodiagnosis at Perinthalmanna MES College. He has bagged many honors, including the state government's award for the best doctor in 2016. He has also served as the president of National Radiological and Imaging Association and as Dean of Medicine and member of Governing Council, KUHAS. May I take this opportunity to heartily welcome our chief guest, Dr. Mohan Kundamal, to officially inaugurate today's valedictory function.
Thank you and good evening. President of today's Phoenix 2021 function and the most energetic president, Dr. C.V. Pulayat, eminent speakers participating today's meeting, Dr. Vamsi Krishna Reddy, Dr. Sriram Venkataraman, Dr. Bipin Gopal, Dr. Simon Morrison, Dr. Jacob Matthew, office bearers of the organization, esteemed members of this wonderful organization, and my dear students, ladies and gentlemen. I'm extremely happy to be a part of this great program, Phoenix 2021. In fact, when I was told that this association, which is 10-year-old, has got about roughly 90 members only in the state, but the conference has got about 4,000 registration. That is quite amazing. That's very amazing. And that probably due to the times through which we are passing. We are passing through a huge pandemic. And in this huge pandemic, our focus is changing. Our focus is changing to public health. Public health is the catchword and watchword of these days. Whether it is in dentistry, whether it is in general medicine, or whether it is in some other area, public health has come to the center stage. In fact, public health was disregarded and it is not considered as a very glamorous specialty, but now we realize it's a very important life-saving specialty. Now your life can be saved by epidemiology. People never thought that epidemiology is all that important. Now your life can saved by statisticians who can predict whether the third wave will come, when will the second wave enter, either any possibility of a fourth wave. So all these comes under public health, and therefore public health is in the center stage. And regarding public health industry, public health dentistry, I realized that even the Dental Council recognized just few years ago. Till 4 or 5 years ago, to start a dental college, you don't need a department of public health dentistry department. Now it has become mandatory. And as it has been rightly said, there is only one postgraduate department in Kerala offering this wonderful specialty, and the first batch from Kottayam Medical College, Kottayam Dental College has just passed out. At this juncture, I would request all other colleges, all dental colleges to come forward to start this most important, all important specialty. In fact, here the association can take a lead and request every dental college to start a public health dentistry MDS course. And I assure you that the university will definitely support university, because we realize that this is all important specialty. And now I have been observing a very, very peculiar situation. Actually, Kerala has got the health, public health or the primary health facility in every nook and corner. We have got, every village has got a wonderful primary health center, sub-center, all these are available, and medical facility is available. But what about dental facility? Dental facility is not available in the rural areas. It is not, and generally our people are healthcare seeking people. And you may be aware that Kerala has got all the wonderful public health determinants like the infant mortality, maternal mortality, and all these things. And great researchers have said that this is due to the health seeking behavior of Kerala population, especially the literate, educated females. They seek and they see that their kith and kin gets good healthcare, and that is why, even though Kerala's morbidity pattern is quite bad, on par with UP, our mortality is very low. That is, we are surviving because we are seeking health. But we are not seeking support in dental area. Dental health seeking behavior is not there in Kerala. This is what I have been observing. And this is because of lack of awareness. That is the most important thing. A preventive dental care is all the more important, not only cosmetic, but for the overall general health. And it is extremely useful in detecting early oral cancer and many other areas. But unfortunately, that has not been emphasized by the experts. And here I will blame the Dental Association, because this association should have an ability to tell the whole people that this is more important, so that people should seek dental services. Therefore, I would request the public health dentistry people who knows this real fact to spread the message that preventive dentistry, dental health is all the more important for survival, especially with the COVID and the arrival of mucormycosis, where the oral hygiene is extremely important. So these areas we must take importance. Probably, I think this is the time for the association to demand that every primary health center should have a dental qualified person. A dental dentist should be there. It's a shame that we have several dental colleges and many of them don't get a job. Who pass out from the colleges don't get a job. They may be getting a job, but it will be an underemployment. At the same time, the country, the state needs a large number of dental services. There is a gap, and this gap has to be filled. And who can tell the government that this gap has to be filled? An association led by a smart president like C.V. Pulayat can ask the government to fill up these vacancies. And therefore, I will conclude my few words by saying that public health dentistry is very important specialty, and that we are realizing at the time of COVID. Of course, when you have a crisis, then only you realize which is more important and which is not very important. So now in this crisis, we realize the most important professional area is public health and dentistry. And I wish this conference and this valedictory function the very best. And I declare that the valedictory function is inaugurated. Thank you.
let us have the official lamp lighting ceremony highlighting the declaration of inauguration of today's program. Thank you, sir, for having graced this occasion with your inspiring words. Now we move on to the next session, the keynote address. We are extremely honored to have with us today an eminent personality, Dr. Sriram Venkatraman. This young physician entered the Indian Administrative Service in Kerala after securing the second rank in UPSC Civil Services exam of 2012. He is also a Fulbright Fellow and a Master of Public Health graduate from Harvard University. He is an officer known for work ethics and integrity. In a short span of time, he has made a strong mark and has become a role model for the youth in Kerala. Currently, he is serving as the Joint Secretary in the Department of Health and Social Justice. Who else is more apt to enlighten us about the changes and challenges of public health in Kerala? May I now invite Dr. Sriram Venkatraman to deliver the keynote address. The stage is yours, sir.
Thank you very much. Very good evening to all of you. It's indeed a delightful experience for me to be part of this kind of a gathering, for which I would absolutely want to thank Dr. Vivek, who was grateful enough to invite me to this program. And we go back a long way together. He was senior to me in school, and then again he was senior to me in college, and then now yet another opportunity for us to be hopefully working together again. So thank you very much, Dr. Vivek, for the opportunity. I would also like to thank Dr. Mohanan. I was listening to your words, and also thank you for the strong impetus that you've placed on the importance of public health dentistry in the way forward, and how the whole COVID experience has only strengthened our views or strengthened the importance that public health dentistry has in the public health scenario of our country. So thank you very much for that, sir. And I have been asked to talk about, or rather in my discussion with Dr. Vivek, we had mutually decided that I would try to talk a little about public health in general, because recently I had the amazing opportunity to be part of an MPH program, a full-time MPH, 1-year MPH program in the US. And that has really kind of helped me open up the idea that I had previously about what public health was. Because as was introduced by Rajni, I'm also basically a doctor. I was junior to Dr. Vivek again in Trivandrum Medical College. So, of course, the fundamental idea of public health that came from med school was a very traditional one, where community medicine or social and preventive medicine was what public health was at that time, and how doctors played a very predominant role in deciding what public health was, in accounting for the major chunk of the stakeholders in what public health was, or probably still is more or less in our country. So that is the context from which I got this amazing opportunity a couple of years ago to go to the US and be part of this MPH program, where my whole idea of what public health was drastically changed. And there we were a cohort of around 100 people doing public health in this derivative called global health. And I was surprised to see that more than half of the cohort, or let's say even close to 70% of the cohort, were non-doctors. And that literally shattered the entire idea that I had built up over the last 10 or 15 years about what public health was from a doctor's perspective, and literally opened up this whole idea, or this perspective of how public health really should be a multi-sectoral coordination kind of a philosophy, and not just about any single sector of people calling the shots. So that was exactly what happened in that 1 year in Boston, and thankfully a couple of years after that I am getting to for the first time probably talk about public health. So this is just going to be a very brief exchange of experiences that I've gathered from all of my academic experience, as well as from the last more than a year that I was joint secretary in the Department of Health, and that is around the time that the whole COVID pandemic started, and we all were together in what then happened and what has been happening right now. So we all know that India has traditionally had a very rich history of thinking about public health, or it had a very strong inkling right from the beginning that public health did or does deserve a very central position in the whole web of policy. And we all know about the board committee and how there was a strong impetus on primary healthcare and the three-tier healthcare system that was envisioned, and that's still going very strong, especially in Kerala, and the whole lot of it, and all of this strong history, and also to add to that, all of the amazing vaccination programs that we've been able to implement in a population of this size. It literally amazed the world how you can literally every year administer polio vaccine to a target population that is a set of more than 1 billion people. So it literally changed the way we thought what we could do in terms of public health, and also all of the amazing vertical programs, malaria, HIV, and all of the communicable diseases that we have been able to very successfully contain through multi-sectoral cooperation through these vertical programs. So we have evidences of strong public health work to add to our track record. But even then, in spite of this, what we see is how curative medicine, at least until a year ago, curative medicine still played the central role in the whole universe of public health. So even then, curative medicine was considered to be, what a large chunk of public health was or is, and how we think that health is equivalent to hospitals. That is the thought that we had. And then what are the changes that we have all been going through in the last more than a year? Of course, COVID-19, this small virus that just came, and then suddenly shifted our attention to what we had previously taken for granted as a part of public health, which is prevention. So it has totally shifted the idea, not just of policymakers, not just of the health sector, not just about doctors and public health specialists and dentists and other allied doctors. It's not just about the people working in healthcare that have been forced to shift their focus, but the entire society has now started thinking about public health and about prevention. And what exactly is public health? That health is beyond hospitals. That is the primary change that this whole experience of the last year and more has brought to our thinking. And this shift of focus from curative medicine to a wider perspective of what exactly defines health, what exactly determines health, what are the determinants of what you think health and well-being are. This change is actually a moment of opportunity. It has also brought in us a realization through our experience of the 1 year of how a multidisciplinary approach is what is required. I need not tell you, but I have to mention here about Kerala's strong network of health workers. We have ASHA workers, we have JPHNs, and we have public health inspectors, and also of allied sectors such as Anganwadi workers, such as Kudumbashri workers. These are our foot soldiers who have been working day in and day out to ensure that our strategy against COVID-19 is being effective. Just imagine starting right from the process of testing a person, detecting someone as positive, and tracing all of their contacts, ensuring that they are quarantined, ensuring that they are getting all the health inputs that they require to stay safe at home, to running field hospitals such as CFLTCs, to also providing supportive care in terms of assistance to people and a lot of allied things that happens in hospitals. So from end to end, all of these foot soldiers, all of our frontline workers, which they were also envisioned as a part of our public health strategy a long time ago, they have now suddenly come into the forefront. They have literally taught us that public health is about intersectoral coordination. So now, in addition to that, another area that has suddenly gained a lot of importance is health insurance. So before COVID came in, health insurance was just this peripheral thing, that there was private insurance, and people who wanted to get private insurance, they could go and pay money and get private insurance. There was this sector of people in the society that were insured by social insurance and or government-sponsored, government-led insurance. But that catered to only a small sector of our society. And then the number of hospitals that they could approach to gain some sort of service through this insurance was also limited, where we had a handful of large major private hospitals partaking in the social insurance scheme of the government. And that number has suddenly skyrocketed to hundreds of major hospitals across the state are now part of the Kerala Arogya Suraksha Paddhati. All of this happened because COVID-19 somehow forced us, or rather, it rather pushed us to explore beyond our conventional ideas of public health. So that is the kind of change that we've been going through, all of us together. So in every way possible. And another point that is very important to mention at this point, at this juncture, the same way that I mentioned how frontline workers, how our foot soldiers of ASHAs and Anganwadi workers have really helped us impact the way we face this pandemic. There is also another sector of people, which includes people like you, people like dentists, Ayurveda doctors, homeo doctors, the whole the vertical of Ayush. And all of these people have actually started partnering in how healthcare is. That is, I'm talking about curative healthcare. I'm talking about field hospitals, CFLTCs, CSLTCs, domiciliary care centers. So running control rooms at the district level. So all of these allied sectors that were previously thought of as mere verticals. So you take care of this part, you take care of this part, you work in this way, you work in this way. From that kind of a, thinking in silos or thinking in watertight compartments, we started thinking about intersectoral collaboration. Where exactly can we think about this part taking care of this? Where can we think about these two people working together to address this? So that is how our thinking of how public health is to be, executed has changed. So that is where we stand. This is the moment of opportunity where now we can think forward, and we have a kind of canvas that's empty right now. We've just started painting on the canvas. And this is where we have to start drawing a new picture of what public health is. But what are the challenges that we are going to face in this way forward? So that brings me to the second part of what I have to talk about. What are the challenges that face public health in India today? First, we have to be aware of our limitations, about the externalities that we have, that we did not think about before COVID-19. For instance, how much are we spending on public health? It's a very critical question. How does our health financing work? If we have a comparison between India and the US on the one hand, and the UK on the other hand, how are these countries executing their public? How are they funding their public health? And how are we funding our public health? We as a society have a very large proportion of our health needs being taken care of by what is called out-of-pocket expenditure, especially in Kerala with what Dr. Mohanan rightly pointed out as a very high health-seeking behavior. This is a very, 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 very important component of thinking about public health in Kerala, because with a high out-of-pocket expenditure and with a large proportion of the society seeking public health in a state like Kerala, that amounts to a lot of money being spent by individuals, by families to get healthcare, which can potentially throw them into what is called a poverty trap. If a family that's living in the margins has to spend out of pocket for their healthcare, let's say somebody in the family got COVID-19, had to be hospitalized in the ICU, and that person sought private healthcare, which has been our habit, because around half of our society depends on private healthcare in Kerala. So if, let's say, a marginal family had to depend on private healthcare for COVID-19, and unfortunately that person had to be ventilated or had to be put in the ICU for a couple of days, then that literally sucks out what they have in forms of savings. And that literally pushes them into what is called the poverty trap. And this is one of the concepts that got Abhijit Banerjee and Esther before the Nobel Prize in Economics last year, about how these poverty traps work. So there are these things that work as limitations in our way forward. And what about engaging the private sector? I was just mentioning to you how 50% of our population depends on the private sector. But have we been meaningfully engaging with them in the past? Private sectors have conventionally been working in these verticals, in these silos where they provide curative healthcare. But now we've started thinking, how can we engage them in public health? Are we now administering vaccines through private hospitals? Yes. Is their role in administering vaccines increasing? Yes. Are they taking care of COVID-19 patients? Yes. So private sector is now being actively engaged in the whole public health discourse. So this is another huge challenge that we have going forward. How do we more meaningfully engage them? How do we engage them in policy making? How do we bring them to the table to discuss on what is the way forward? This is another thing that stands as a huge challenge in front of us. And another challenge that we have, again, now we've started thinking about quality of care, something that we've never thought about before. Our idea now until this point was ensuring access, ensuring minimum quality of care, ensuring access to that person, ensuring equity of access. That's all. We've never spoken about quality of care before. But right now, when we start comparing mortality in COVID-19, for instance, what are we looking at? All of this mortality, a major chunk of the mortality in COVID-19 happens in ICUs. So now we have started talking about quality of care. So what is required now is to treat the person well. So quality of care is something that is going to be a huge challenge going forward. Again, a big, huge challenge that we've all seen playing out in front of us is data. How do we collect data? How do we manage data? How do we transmit data? How do we analyze data? What does big data even mean? How can we bring in, all these uber new concepts such as machine learning and artificial? They're all being talked about. If you read articles from the West, everything is about machine learning. Everything is about artificial intelligence. To be very frank, I have no idea what these things mean. I don't know if a lot of you know the extent to which these new technologies can impact public health decision making. So these are things that pose challenges in front of them when other countries that we aspire towards. Kerala is a very developed state. Our human development index is on par with Western countries. Some of them even match Scandinavian countries, for instance. So that is our aspiration. That is where we want to get as a society. We want to equate ourselves with the West. We want to equate ourselves with Europe, with Scandinavia in all of these human development indices. So when that is the case, we have to automatically compare ourselves with them. What are the tools that they are using to analyze the data that they're collecting and to impact policy using that data? Are we using data in the right way to impact our policies? And is it happening at the right time? Is the refresh rate good enough? So these are the challenges that we have going forward. And another huge challenge, and this has, of course, to do with vaccination, and it is about adopting and scaling up new technology. Is that not a huge challenge for us? Something that we had taken for granted, India being the largest producer of vaccines in the world previously, we still are. But did that help meet our needs for COVID-19 vaccination? Unfortunately, no. We came to a point where we were the largest producer, we still are the largest producer of vaccines, but are we getting enough vaccines for our target population? I mean, there are roadblocks, as all of us know, but how do we solve that? How do we adopt new technology? How do we scale up new technology? We're talking about starting vaccine manufacturing units in the state. How do we do that? That's something very new to us, something that we have taken for granted that vaccines will come. But at a point where we have to start thinking about being sustainable, even in that aspect, that is another public health challenge that we all have to face going forward together. And end of the day, all of this comes to what this single mantra called intersectoral coordination. This is not just about doctors anymore. This is not just about medicine anymore. This is not about healthcare. The term is not healthcare. Healthcare is not equivalent to public health. H for hospital and H for health. No, that is wrong. Health is public health. And how do we ingrain that into everybody's mind? By ensuring intersectoral coordination. By making sure that people from different backgrounds, with different experiences, with different expertise, coming together to the table to sit together and think together. How do we do that? How do we bring all of these people up to the level where we can all sit together and discuss policy? That is where courses such as public health, as we all know, public health is not a STEM degree. In the US, all these science and technology related derivatives are called STEM degrees, and public health is not a STEM degree. Medicine is a STEM degree, but not public health. Public health is a humanities degree. That means any person with a graduation and any person that has the right attitude and aptitude to think about public health, to work in public health, with some kind of expertise. It can be either data analysis, he can be a data scientist, he can be a dentist. A lot of my friends at Harvard were dentists. A lot of amazing public health professionals right now in the world, in the Western world at least, are dental professionals. How can we bring all of these people to the table? By ensuring that they have the passage, they have the pathway to get to the table, and that is through public health education. That is where the importance of public health education comes in. There is clinical medicine, which is exceptionally important even in this scenario. I'm not belittling in any way what clinical medicine means, but in addition to that, there is this layer that has to coordinate all of this, of which clinical medicine is an important component. So there is this layer of public health that has to get people from all of these verticals. We need dentists there. We need Ayurvedic doctors there. We need homeo doctors there. We need data scientists there. We need people with a policy background there. We need people from pure sciences there. We need microbiologists. We need biochemists. We need chemists. We need doctors. Yes, we need nurses to come there. We need paramedics to come there. So that is what a public health degree does to you. It helps you expand your horizon. It helps you expand the way you think. And it also helps you connect to this network that enables, gathering of information and wisdom and knowledge from all of these nodes and putting together what is called an amazing public health infrastructure in the state and in the country. So that is probably the challenge and the opportunity that has presented to us at the same time in the form of COVID-19. It is a huge challenge. It is something that shouldn't have happened. That is very unfortunate. But how do we see the bright side of it? It has also opened up a Pandora's box of possibilities for all of us to explore. And public health dentistry is, in that sense, something that is moving in the exact same direction that it has to move. This is something that has an amazing bright future. And these, meetings of this sort, gatherings, I would call them gatherings, and experience sharings and knowledge sharings of this sort that have people from all walks of life coming together and talking about something that's critically relevant to our times. Hats off to all of you for having pulled this off. And I again thank all of you, Dr. Vivek especially, but then not just Dr. Vivek, all of you for having been there and for organizing this and for thinking that I could, be a small part of this exchange of ideas. I look forward to a lot more of you, coming into public health. I would just like to share one teeny bit of experience just before I log off, is that we recently conducted this, interview for hiring epidemiologists to help us with a lot of data related to COVID-19, the state government. So I was, fortunate enough to be part of one of the people that interviewed these people for the post. And around 20 odd people participated. And I was so glad to see that close to half of them, around 10 of them probably were dentists. A lot of them were Ayurveda doctors. Some of them were homeo doctors. I was so glad to see that change. 2 of them were actually MBBS doctors as well. So this is amazing. This is exactly what I'm talking about. For all of these people to come together and think together and work together. That is the only way that we can impact change, working through our limitations and challenges to get to the place that we want to be, to truly become a developed society the way all of us aspire to be. So thank you very much for having me, and thank you for this brilliant evening. I stop with that. Thank you.
Thank you, sir, for the captivating message. When IAPHD Kerala chapter was in its inception, we just had a handful of public health dentists, and today we have extended our horizons to accommodate 90 members and are always welcome for even more. The idea of IAPHD Kerala chapter directory was thought of to keep our family connected and united. At this point, it would be worthwhile to appreciate the efforts by Dr. Siraj Panakal, who has connected and reconnected with every member in this family to make this a reality. To do the honors of delivering the address by guest of honor and also releasing the directory, may I now invite Dr. Vamsi Krishna Reddy, a well-known personality in Indian Association of Public Health Dentistry. He is Secretary of IAPHD, Professor and HOD at Anil Neerukonda Institute of Dental Sciences, and has immense experience in managing academic affairs at university level. Ladies and gentlemen, please welcome Dr. Vamsi Krishna Reddy. Hello, sir. Hello, sir. Are you audible? Hello, can you hear? I think we are having some technical glitches here. Can we have the technical support team?
Yes, indeed, ma'am.
Dr. Jha, I think I would make him a co-host. Thank you.
Yes, I'll do that, sir.
எல்லாருக்கும் வணக்கம் and good evening Kerala and IAPHD Kerala chapter, especially the president Dr. C.V. Pullath and a dear friend of mine. We both started working for the association from very long time, and it was many of his inspirational thoughts that has helped in the growing in the association as well. And the secretary of the IAPHD Kerala chapter, Dr. Sudeep, and chief guest for today, Mohanan sir, the Vice Chancellor, Kerala University of Health Sciences, and tremendous contribution by Additional Health Secretary for Public Health in Kerala, and his inspiring thoughts and provocative ideas, which will lead all youngsters to get motivated themselves and participate in the public health of the country. And I watching closely, following the day-to-day activities of the Phoenix that is 2021 that is happening. A tremendous job by the entire organizing committee and they left not even a single stone unturned, and the kind of participation, especially from the undergraduate students across the country, was immense, which helps definitely to grow the specialty and increasing the knowledge base. Coming to the public health dentistry per se, and the role of the association, how we worked and how the previous office bearers and all the members have helped. Initially, it was a tough time for all of us right before we joined the public health dentistry also. The department was run by other specialities and other foreign degree people, and we played an active role in establishing ourselves in almost all the colleges in the country, especially in academic point of view. Slowly, gradually, we moved from academics to research methodology and tobacco cessation, wherever it is, we are there. And we are, to say precisely, I mean, as a public health dentist, we are not confined only to the academics. It is not about we teaching only in the dental college. What we teach our postgraduate program and what we train them and what we want to see them and what kind of training the background that is going on in all the postgraduate colleges in India, and especially even an undergraduate level. The training that is given to them is not about only going and doing a camp or an outreach activity. We are developing them as a program manager. We are developing them as an epidemiologist. We are developing them as a statistical programmer. We are developing them as a health consultant. We are developing them as an able administrator. And not only all these things, and kind of especially the public health dentistry department becomes the face of any dental college institution. Any institution, the first the management thinks about is public health dentistry, how they project the institute and the facilities that are available in the institute to the people and spreading into the outreach. And the last part we think about is academics. We have so much scope and openings in corporate field, and especially the way the healthcare system is, especially when facing this pandemic, the innovative thoughts and the war room activities, the programmers, the designers, the consultants of health, there is a lot of scarcity that is there, and we are very well equipped. Being a public health dentist and being a public health specialist, we are going to penetrate and pierce into the market so well, and there is a huge scope for all of us to work and go forward. And academics also, the Dental Council of India new UG regulations will be coming as soon as it is, the file is pending at ministry, and it will be coming for it to create more job opportunities in academics as well. But our focus is more on more than beyond academics, where the 6 to 7 points I have told, I put academics at the end. We have more outer reach into the different pharma industry and research industry, where clinical trials, all these things are there. This per se about the subject, and not only this, along with as Vice Chancellor was telling that our penetration rate to the primary health center level, already representations was given to the government of India and many state governments to recruit public health dentists as a priority compared to the other specialty at least CHC and UHC, and at least one in a public health primary health center as well. And you all know most of the state nodal offices for national health, oral health cell are being public health dentists in most of the states. And we are also part of the ICMR reviewers, and we are currently getting ourselves associated with working very closely with the National Institute of Disaster Management. We are going to start an MOU with this, and this will help our enrich the public health dentistry program more in India. And we are working with the union, we are working with Special Olympics, and we are working, we have already developed a competency-based learning modules. A special working committee under the leadership of our President Pushpanjali started. I mean, the program is going on, and curriculum reforms we have submitted to the Dental Council of India. And along with this, we are developing public health dentistry various competencies where a team is working on it. And like this, we are going forward with a tremendous pace, and with the help and support of all the members, not only the office bearers and each and every member from the state of Kerala and across India, who is contributing for enriching and pushing the specialty forward. I once again congratulate the entire team organizing committee of Phoenix 2021 under the leadership of CV Pulayat and the president, Kerala chapter, and Dr. Sudeep, secretary, and senior faculty, Dr. Susan Thomas, madam, and Dr. Chandrasekhar, Dr. Rajini, Dr. Vivek, Dr. Shamad, Mohammad Mutedar. I might have missed many names, and each and everyone's role in this is very commendable. I appreciate. And now I declare the open of the directory.
Thank you, sir, for being with us today and enlightening us. Now let us listen to the felicitation message by Dr. Fuad Odinju, President of World Medical Association at Suryoyo, Germany, a scholar with a trail of educational qualifications and more than 200 scientific publications to his credit. He teaches medicine and medical ethics at several universities and is also a member of many scientific societies. Dr. Fuad Odinju has been awarded the prestigious Vincent Semi Award for Oncology and M4 Award for Personalized Medicine. So let's watch the video now.
Good afternoon and good evening, my dear friends and colleagues and all of your delegates taking part in this very beautiful and amazing Phoenix 2021 conference of the Indian Association of Dental Public Health. I am Fuad Odinju and I am the president of the World Medical Association of Suryoyo, and my specialty is hematology and oncology, heading here in Munich, Germany, the Department of Hematology, Oncology and Palliative Care. And besides, I'm a professor of medicine teaching at the University of Munich. I'm very happy and honored to get this opportunity by my distinguished colleague and friend, Dr. Sivi, to take part in your conference. And I have to admit that I'm really impressed by such a huge variety of topics and contents of public health and dentistry. And you are really doing a very big and great job, which is very useful work and beautiful activities over a period of time of longer than 10 years. And the fact that more than 4,000 delegates are taking part in this conference is proving the importance of this topic and the need of this topic. So once again, I want to congratulate to all of you and to make progress in this field and to go ahead to keep your Indian Association of Public Health Dentistry alive and making scientific progress, but also progress in humankind, that you're helping your people, which is very important, and especially under these very special circumstances we are living at the moment, facing this horrible COVID-19 pandemic. And we are listening to the news and getting this information about the numbers of the diseased people there suffering from corona and also the people dying from corona in your very beautiful country. We are thinking of you and we are all praying for you to overcome this pandemic as soon as possible, and hopefully that you stay safe and stay healthy, you, all of your delegates, together with your families and beloved ones. So once again, I wish you a very pleasant time and a beautiful closing ceremony there. And my special greetings to Dr. Sivi, who has invited me, and a beautiful person I met in 2017 when we founded our medical association, the so-called World Medical Association of Suryoyo, VMAS, for the promotion of health of our people, of the Aramaic and Assyrian people. And then an Indian delegation together with Dr. CV, together with Dr. George Abraham, this distinguished colleague of mine, who's a surgeon and specialist in kidney transplantation there in Kerala, a world-famous man, a great, great doctor, and together with His Grace, the Bishop, Mor Theophilos Kyriakos from the Zurich Orthodox Church, who all came to Munich, to Germany, to join us, our conference, and to found a World Medical Association of Syria. I'll never forget this beautiful time, together with the Indian delegation, especially with my distinguished colleague, Dr. Sivi. So, once again, congratulations to this beautiful conference. Thanks a lot for giving me the opportunity to take part, and wish you all the best, and stay healthy, and God bless all of you.
We place our gratitude on record, sir. It is indeed priceless to receive compliments from stalwarts of such international repute. Public health dentists are often privileged to work alongside with professionals from other sectors with a common goal of improving community health. It is indeed a great pleasure to listen to what our stakeholders feel about these interprofessional ties with IAPHD Kerala chapter. We have with us today Honorable Secretary of IDA Kerala State, Dr. Deepu J. Matthew. I invite you, sir, to share a few thoughts.
Thank you, Mrs. Rajni. Am I audible?
Yes, sir.
Thank you once again. I would like to thank the IAPD PhD for the gracious invite to this valedictory function of Phoenix 2021, this virtual conference that has been hosted by this association. This IAPHD is being ably steered by the vivacious Dr. C.V. Pulyat, who indeed is a multifaceted gem on the dental horizon, and of course, the great organizer in your secretary, Dr. Sudeep C.B. We in the IDA, which is the largest organization of dentists across the country and in Kerala, we recognize this Herculean effort of conducting a week-long virtual conference, and that too in these trying circumstances. And we indeed salute the Kerala chapter of the IAPHD for this magnificent performance of collating so much content seamlessly across so many platforms and across so many days. At this point, I would like to take the opportunity to impress upon you, all those here who are present, the need to continue the good work that has been done by the IAPHD over the past 10 years and by the Indian Dental Association over the past many years in creating public awareness about dentistry across our country. Like our Honorable Vice Chancellor, Dr. Mohan was mentioning, the awareness levels of the need of good oral health and thus ensuring better general health is in fact dismal when you look at a pan-country status. Part of this definitely arises because of the lack of governmental support. And we've been trying at the IDA to impress upon the government for the need of a comprehensive oral health policy, which at this moment of time is not present in India and neither in the state. This is evident, as Dr. Sriram was mentioning during his talk also, that there are many verticals, and he was mentioning about insurance. And we must all understand that at this point of time, barring a few surgical procedures, none of the insurance policies, whether the government policies or the private policies, cater to dental treatment services. So this itself shows the neglect that has been seen by the bureaucracy, the administrative levels, and everyone across, that the neglect that dentistry is receiving over the years. And it is something that we in the IDA and all our affiliated organizations, our sister organizations, and the profession in general, we have to look up and try to create a better platform for all of us. This good work that has been done by IAPHD will be able to create more awareness about oral health. And this has been evident during our pandemic. Allow me to share what we've been doing during this pandemic. We've been able to assist the government in the fight against COVID. by providing voluntary services for testing, especially in some areas where there was a lot of infections rate, where the high test positivity rate was high. We in the IDA have provided voluntary services across all districts of Kerala, and we've been able to help the government in these things. And during this time, we've created a number of awareness videos and talks for the general public so that they can have more awareness about how to prevent COVID from spreading. As for members, we in the IDA, we have been able to convey all the latest developments regarding treatment protocols, infection control protocols, and this has been amply demonstrated in the fact that very few dentists have been contracted the disease during the course of treatment, and our clinics, our practices, our all the departments in across the state have maintained such a good level of infection control practices that there has been very few instances of infections in dental clinics. We also have been able to facilitate insurance schemes for COVID during these times for our members. To wind up, I would like to once again congratulate and recognize the effects of the team behind Phoenix 2021 and call upon all those attending here today and listening to me to use your educational background and your training to increase awareness about dentistry and its relevance in oral and general health in our society. Before I stop, I would be failing if I do not definitely mention the name of that gentleman, Dr. Sivi. Is indeed a great person, and hats off to you for being behind this stupendous show. Before I signing off, I would like to wish everyone all the very best and request you all to please stay safe and stay healthy. Thank you and Jai Hind.
Words of praise are always a joy to be heard. Thank you, sir. Now let us listen to the felicitation messages from Dr. Simon Morrison, Deputy Director of Health Services, State Nodal Officer for Oral Health under National Oral Health Program, and Dr. Bipin Gopal, State Nodal Officer for Non-Communicable Disease Control Program under Government of Kerala.
Good evening to one and everybody. Let me start by wishing each and everyone a happy Public Health Dentistry Day. The last few years have been activity rich as far as the National Oral Health Program is concerned. I acknowledge that public health dentistry has a vital role in oral health promotion and spreading oral health awareness in the public. In the last few years, public health dentistry departments of various dental colleges have conducted innovative ways to spread the message of oral health. Prevalence of oral diseases is very high in India, with the highest being dental caries at 84.7% and periodontal disease at 79.4% in 65 to 74 years old as the most common oral diseases. Since 70% of the population reside in rural communities, oral care at dental clinics and tertiary centers or colleges won't be suitable. In such situations, the main role of public health dentistry is to understand the distribution and determinants of oral diseases and to educate, motivate, and promote oral health in diverse populations. The ability of a public health dentist to work at the grassroots level in close association with the LSGD, Panchayat, or ICDS schemes to aid in greater public-centric activity concerning specific needs of oral health. PhD specialists usually have a closer understanding of dental problems in their target population and have expertise in dealing with community affairs, and so can make a decisive influence in the development of health programs that are in the best interest of both public and the dental profession. The specialty does not deal with the individual patient, but utilizes the 4 levels of prevention to curb a health issue from the base. Thus, the budding field of palliative dentistry has greater relevance to dental public health in India and our state. Kerala constitutes one of the largest proportions of the geriatric populace in the country. Oral health problems, ulcers, mucositis, pulpitis, and abscess harm general health and quality of life and can be acutely debilitating in these patients. These patients with existing comorbidities are at increased risk of developing oral complications. The PhD clinicians could suitably be called a family dentistry, as he assures that care is provided to every needy at their doorstep through mobile dental units. Public health dentistry has a significant role to play in the multidisciplinary team of palliative care. In the postgraduate curriculum, PhD specialists are trained in every clinical specialty to provide comprehensive care to patients and specific needs. During the pandemic, specialty had been entrusted with the task of infection control, screening, mapping, and institution COVID protocol development task, because to a greater understanding of epidemiology and how the principles could be mobilized in such situations. There is a huge untapped potential in the private dental college sector. I request all of you to earnestly cooperate with the Directorate of Health Services of our state to promote dental public health. As the State Nodal Officer for National Oral Health Program, let me assure my support to all your ventures and all the best wishes for the Phoenix 2020-21, the virtual conference. Thank you.
Good evening all. I am Dr. Bipin Gopal, State Nodal Officer for Non-Communicable Disease Control Program, Government of Kerala. As we all know, a beautiful day begins with a beautiful smile. And for that beautiful smile, we need a healthier and stronger teeth. It is just not for the smile, for our general health, to keep us away from diseases. To have a self-confidence, we need to have a proper dentition. So the awareness on proper dentition is very essential for all of us, not just the dental profession, but the general physicians and the general public. Everybody needs a awareness on the proper dentistry. So the attempt by the Indian Association of Public Health Dentistry to bring out a virtual conference on various modalities of dentistry is very laudable. The Phoenix 2021 is a noble attempt in this regard. So I wish them all success, and I wish that everybody who listens to this conference benefits from it. Not just the clinicians, but the general public also benefit from this. All the best.
Thank you so much. It was a great pleasure listening to you all. Moving on, online dentistry has been the channel partner for Phoenix 2021. We are forever grateful for all the timely support and technical assistance rendered for the smooth conduct of this conference. Now, I welcome Professor and HOD of Pedodontics at Anno Dental College and the Academic Head of Online Dentistry, Dr. Joby Peter, to share a few thoughts about our collaboration.
Good evening, doctors. This is Dr. Joe from Online Dentistry. Dr. Joby Peter, sir, could not attend the session as he is in another meeting at this point, but sir has conveyed his regards and warm wishes to all the candidates who are attending this program, and also to sponsors and the organizers of the session. Sir has asked us to give a quick glance into what online dentistry is providing. So in the numbers and statistics, as you can see, we were established in 2008 with a total of 122 offline courses conducted so far, and have conducted 500 plus online courses during the pandemic. At present, we are amassing 20,000 plus candidates in our platforms, that is on multiple platforms. We have grown to 10 centers across India, including, you name the biggest city that you know, we are there. And in this growth, we have amassed almost 20,000 plus candidates in our followership. We thank all those who supported us in our venture, and we are so glad to be a part of the Phoenix 2021 conference. And all the best. Thank you. Also, please note, these are our online presences. We have our website under the name www.onlinedentistry.in. We also are available on the social platforms such as Facebook, YouTube, and Instagram. Thank you. Over to the MC.
Thank you, sir, for the best wishes. As all wise men say, success is never an accident. It's all about hard work. I invite Dr. Shanavas Pallel, Awards Committee Convener of Phoenix 2021, to take over with the announcement for the prestigious IAPHD Awards for Public Health Dentists who have excelled in their field of work. Despite his huge responsibility as Assistant General Manager at DM WIMS Medical College and Aster WIMS Wayanad, he has dedicated a lot of time and energy for this conference. He is an empathetic public health dentist who always attends to every beckoning call whenever the community is. And also, he has to his credit many recognitions and scholarships for his research presentations at national and international conferences. Over to you, Dr. Shanavas.
Welcome to Phoenix 2021 Awards. I'm Dr. Shanavas Pallial, DMM's Medical College, Wayanad. Thanks to the organizing committee led by Dr. C.V. Pulayat for giving this great opportunity to present this award. I would like to introduce our award committee members, led by Dr. Sendil M., Indira Gandhi Institute of Dental Sciences, Puducherry, Dr. Deepan Kumar, CV, PMS College of Dental Sciences and Research, Trivandrum, and Dr. Aravind, Kollam. Special thanks to Dr. Deepan Kumar CV, who has been the backbone of the award committee. Dr. Deepan meticulously designed all the categories that was the most important attraction of Phoenix 2021 Awards. We have received more than 70 entries from 12 categories from all over India, and all the entries were exceptional. Now let's hear a few words from our judging panelist, Dr. Sendil M.
Good morning all. This is Senthil, public health dentist working at Indira Gandhi Institute of Dental Sciences, Pondicherry. I take this opportunity to thank the Indian Association of Public Health Dentistry Kerala chapter for giving me an opportunity to become one of the panel members for the award category in Phoenix 2021. I would definitely appreciate the efforts of the award committee for doing a very systematic method of evaluating and getting involved. As most of the awards, they've created Google Forms and the criteria were very apt, and they've asked us to fill the Google Forms, so it becomes more methodological way and systematic way to evaluate the criteria. Coming into the participants or the entries of the award criteria, it was one of the toughest jobs I have faced because there were too many good entries in each categories, and the entries were from Pan-India and more particularly from the colleges of Kerala, and each work or each program was unique on its own way. So we had a tough time in judging which is the best outcome, but we may have to fix certain criteria to select the best, and it doesn't mean that other works are not good or worth it. It is good on its own, but when it comes for evaluation, we may have to set some criteria. With this, we have tried our level best to select best in each categories, and best wishes to all the winners who got the best awards, and the others who contributed towards this award criteria, their entries. Keep up your good works, and there is miles to go in public health dentistry in India, because the public health dentistry is an evolving field and which needs more contributions towards people of India. And finally, I thank the organizing team and especially the awards committee for giving me an opportunity, and it was a very great learning experience. Bye, and from Senthil and Jai Hind.
Thank you, Dr. Senthil. And now this is the time.
Thank you, Dr. Shanavas. Being the best is sometimes the creation of a signature. May I now invite our President, IAPHD Kerala Chapter, Dr. C.V. Pulayat, to acknowledge the members of IAPHD Kerala Chapter who have proven their excellence and made their presence felt with their remarkable efforts.
Thank you, Dr. Rajni. Let me ask our Dr. Joe whether the video is complete or not. The results has not been announced.
We can have that session after your Presidential Appreciation Award, sir.
Thank you. Thank you. Good evening, one and all. Once again, being the president of this association for past 3 years and being the secretary of this association from 2011 to 16, I always felt that the contribution of the members has to be appreciated. And let's go ahead with certain presidential awards. This was announced in our group, but to be very frank, many who have a lot of laurels were reluctant to respond because they don't want a publicity. So I myself searched and found a few. You can even see my name there, but that is not purposefully included. Let's go ahead with the slides. Presidential Appreciation Awards 2021 in Phoenix Conference. Dr. Chandrasekhar Janakiraman, who was the founder president of IAPHD Kerala State. He has successfully completed the NH Fellowship on Oral Informatics and also the prestigious honor of becoming a diplomat of American Board of Dental Public Health. He has so much of qualifications in his head and his title, and he is a proud member of IAPHD Kerala. Congratulations, Dr. Chandrasekhar Janagiram. We take this opportunity to convey our regards to you. And here we have Dr. A.B. Alukal. Currently, he is the treasurer of IAPHD Kerala State and the head of the department at Mar Basilios Dental College, Kodamangalam. He has completed Global Tobacco Control Program from Johns Hopkins University, Baltimore, USA, and selected for the Scholars Program in Tobacco Control from JHSPH USA 2021-22, and he is the first public health dentist from India to get selected for this prestigious program. Congratulations, Dr. Abik Alukal, on your achievement. This is Dr. Soumya Muralidharan, a proud member of IAPHD Kerala. He has been selected as faculty guide for the undergraduate ICMR short-term studentship research proposal 2020. Really an inspiration, Dr. Soumya. Congratulations. And here comes the next, that is myself. Just move on the slide. I have been lucky enough to get the best trainer award in Kerala. Now, Dr. Swati Anand PJ is an active member of IAPHD Kerala. He is a director of short films and the South Indian International Film Award for the best experimental short film for his short film Someone. We will be posting the link in the group very soon. Please do watch the movies. Being a public health dentist and he being a director, and we want to see you as a movie director very soon. Congratulations, Dr. Swati Anand. This is from IAPHD Kerala State for you. Let's move on to the next person. This is none other than our state secretary, Dr. Sudeep CB. This appreciation is for him for successfully completing the NIH Fellowship on Oral Health Informatics and also the prestigious honor of becoming a diplomat of American Board of Dental Public Health. This is not a simple achievement. Congratulations, Dr. Sudeep CB, and we are proud that you are the secretary of IAPHD Kerala. Dr. Varghese Suresh, an upcoming leader of our association, he is the first dentist to be certified as an infodemic manager by the WHO and special external consultant for managing infodemics. We have so much of opportunities. That is what it proves. Once again, all the best wishes, Dr. Varghese Suresh. Dr. Mahmood Muttad, who was one of our guest lecturer for Phoenix 2021. He was the past active member of IAPHD Kerala, currently working in Saudi Arabia. He have conducted so much of program there in the Kingdom of Saudi Arabia, innovative program and a persistent program. And he has received the government appreciation from the Kingdom of Saudi Arabia for innovative initiatives in oral health program. I really appreciate and congratulate on behalf of IAPHD Kerala, Dr. Mohammed Mutadat. Go ahead. Wish you all the best. Thank you.
Thank you, sir. Next, we have the announcement of the much-awaited results of scientific session by Dr. Subramaniam R., a keen researcher and academician. Dr. Subramaniam is professor and head of public health dentistry at Indira Gandhi Institute of Dental Sciences, founder member of research-oriented trust called Cohort, past secretary of IAPHD Kerala, and most importantly, the mastermind of the scientific committee of Phoenix 2021. Please welcome Dr. Subramaniam to present the results.
Very good evening to all dear delegates of Phoenix 2021, the virtual conference of Indian Association of Public Health Dentistry, Kerala chapter. I know all of you are eagerly waiting for the results of scientific sessions. Before announcing the results, let me take this opportunity to acknowledge the organizing chairman, President, IAPHD Kerala chapter, Dr. C.V. Pulayat, Secretary Dr. Sudeep, and all the members of the Executive Committee of IAPHD Kerala for their wholehearted support and involvement in making this conference a grand success. Next, I would like to thank our online partners, Online Dentistry, Dr. Joby, Dr. Binu, and Dr. Joe for all the help and guidance for the smooth conduct of this conference on an online platform. Next, I would like to thank my team of scientific committee members, Dr. Pooja, Dr. Venkatachalam, and Dr. Jaslin for all the help and support. So moving on to the summary of presentations, we received 175 presentations from 48 institutions across India. These were the institutions with maximum number of participations. Coming to the breakup of presentations, from the faculty or practitioners category, we received 36 submissions, of which 28 were paper presentations and 8 were poster presentations. From the postgraduate students, we received 60 submissions, of which 40 were paper presentations and 20 were poster presentations. And from the undergraduate and interns category, we received a total of 79 submissions, of which 36 were paper and 43 were poster presentations. Moving on to the judgment criteria, there were 24 sessions held between 20th of June and 26th of June. Each session was evaluated by 2 chairpersons. Chairpersons were selected to each session without any conflict of interest. The final mark was calculated based on the average of marks given by both the chairpersons for that session. 2 prizes, first and second, for each sessions were awarded. And in sessions where the average mark were same for 2 participants, the prizes were shared by both the participants. And there are 6 such sessions. The chairpersons were aware of details regarding their sessions only. Coming to the criteria used for evaluation of these presentations, this is the breakup. Originality for original research and relevance of topic for review articles. Organization of content, scientific rigor for original research and scientific reason or content for review, presentation style and clarity, creativity and aesthetics of slides for paper, and quality of visuals for poster, implications of conclusion and results presented. I wholeheartedly acknowledge all the chairpersons, there are 48 of them, for having accepted our invitation to chair and judge the sessions. So keep calm and await results. Thank you, everybody.
Thank you, sir, for the precise and systematic presentation. That was indeed a lot of results. Sometimes having knowledge is not enough to be an expert in quizzing. It is all about connecting the dots, reading between lines, focusing on logical reasoning, and arriving at a conclusion. Last but not the least, we have the declaration of results for the most popular event of the conference, Mind Melds Quiz Competition. Can we have the results, please? The reward of a thing well done is having done it. However, we would be falling short of our duty if we do not recognize a thing well done and encourage it. May I now request our President, IAPHD Kerala Chapter, Dr. C.V. Puliyat, to render the acknowledgements for our guest speakers who have enriched our scientific sessions.
Thank you, Dr. Mary. Usually, in the conference, we used to hand over a token of appreciation in the form of memento or certificate to our guest speakers. But we have 18 guest speakers coming online with various topics which enriched the delegates. Now, let us take this opportunity to appreciate Dr. Chandrasekhar Janagiram, who delivered the keynote address on the very first day. It was a fantastic presentation, and I would like to remind all the delegates, this session will be uploaded in our association YouTube channel, where you can please to listen to this. It will give you an idea about how to go ahead after your graduation, after your post-graduation public health industry. Thank you, Dr. Chandrasekhar Janagiram. This is a big thanks from the Association of Public Health Industry Kerala chapter. And the first day was very rich by Dr. M.S. Balakrishna, who is a professor in oral and maxillofacial surgery. Such a fantastic show, Dr. Bala, teacher to guru. It was very much useful right from BDS students to teachers, that how to go ahead with the art of teaching. As you highlighted, the word doctor means doctrine, which came from the Latin word which means teacher. So we all understood how to become a fantastic teacher, how to have scientific publications, the art of scientific publication. Dr. Subramaniam R. in just 30 minutes highlighted how to go ahead with your publication of your scientific research. Thank you, Dr. Subramaniam, for enlightening us. And day 3 also was big show by two eminent faculties, Dr. Binu Abraham and Dr. Pooja Lati. Everyone who thought a big shot camera is needed for clinical photography was really enlightened with this session, how to go ahead to have a photography in mobile. So much of tips and tricks. And a topic which very seldom many of us have thought about, an insight into intellectual property rights. Dr. Pooja Lati, that was indeed very informative, that we need to think about more and more. Go ahead in copywriting, having copyright on our inventions. Thank you very much, Dr. Pooja Lati. Day 4 was a fantastic show by Mrs. Smita Harish and Dr. Arun Paul. Tips and tricks in PowerPoint presentation. Many of us, being BDS or MDS or staffs, might not be knowing of so much of tips in PowerPoint presentations. Thank you, Mrs. Smita Harish, for enlightening us. Dr. Arun Paul, you are amazing. Your fundamentals in biostatics was really useful for so much of UG students. I got around 76 messages, 74 or 76, I don't remember, that telling that the session was very useful. Then I was thinking how much the PGs and the staffs might have thought about. Thankful for your wonderful presentation, Dr. Arun Paul. And then we move on to day 5. We had other 2 presentations by Dr. Harish Kumaraj, who is a homeopathic practitioner, but he wonderfully highlighted the relation between emotion and health. And that was an eye-opening session. Chameleons in social media and insight to cybercrime. Mr. Sudeep Sebastian was indeed very useful for even a common man, so that we will understand that where to be careful and where to be carefree. Thank you, Dr. Sudeep. Thank you, Mr. Sudeep, and thank you, Dr. Harish. And on day 6, what happened? Dr. Joby Peter came into scene with the preventive dentistry. Sir, your slides were amazing. Your tips were superb. To a practicing dentist, to a dental student, and to a public dentist, it was indeed gave us a very good insight. Dr. Mahmoud Mutedar joined us from Kingdom of Saudi Arabia and highlighted us how to go ahead with innovative ideas on oral health. Actually, what he told me is that we know these ideas, but we should learn how to implement it and how to go ahead with the comprehensive and increment of this program. We are supposed to go ahead with his innovative ideas. Please do listen to these sessions, which will be posted in IAPHD Kerala, the channel name of our Kerala State chapter, very soon, right from July 1st week. Those who have missed these sessions, please do come to our channel and listen to it. Mr. Sudhir Menon came with YouTube channel creation. He was a fantastic trainer who enlightened us the importance of creating a channel and going ahead with it in the point of a medical professional. Dr. Sudeep CB, writing a scientific paper. That was a simple session, very nicely explained. Even a graduate can really understand how to go ahead with writing of a scientific paper. Dr. Sudeep CB, that was a very, very, very informative session. As you know, we got so much of response in all the groups from all the participants telling that, and I really appreciate that your session has got highest view from among the audience. Congratulations, Dr. Sudeep CB. Moving on to day 8, we have our next set of speakers, Dr. Bindu V. Vaskar, who highlighted on subjective perspective. Many of us are into quantitative research, but she really rightly pointed out the importance of qualitative research and explained it in very simple words how to go ahead with the qualitative research. Thank you, Dr. Vivek Narayan. Palliative care, of course, we know it is something related to a public dentist or even dentist, but you really enlightened us with home-based oral palliative care. That was a fantastic session, which will encourage us to go ahead based on your session. Thank you so much, Dr. Vivek. And today was the last day where Dr. Senthil, our judge for our IAPHD awards, highlighted on how to go ahead with outreach programs and camps in post-COVID era in our dental college. And I was privileged to have a session today. Thank you all the speakers who have supported us in this Phoenix 2021. And I request all the delegates to fill up your feedback form, which will be posted in your WhatsApp group very soon, by helping us to improve this program in the coming days. Thank you very much. Over to you, MC. Also a big thanks to Dr. Sriram Venkatraman, who really enlightened us today with this keynote lecture. Thank you very much.
Thank you, sir. I hope Phoenix 2021 has been a great experience to you all and has added a few memories to your lives. Now, we would like to know how well our efforts have resonated to you. So I request a few participants to give your opinion on the conference, and the floor is now open for feedbacks.
Dear doctors, hope you all had a wonderful session today. May I please see a raise of hands so that I can unmute you and you can identify yourself and give us a feedback about this program. Candidates who would like to give a feedback. Yes, we have the first candidate already. It is Maya S. Dr. Maya S, you can unmute yourself and identify yourself first and give us a feedback about the session.
Good evening all. I am Maya S, first year BDS student from Malabar Dental College. So talking about Phoenix that started on 19th of June. Reminiscing about my experience out there, let me say, it was an amazing section, and where we got introduced to a magnificent rows of scientific presentation, innovative ideas, and creativity, cultivating the creativity in each and every one of us by conducting a series of astounding contests. It was a fun-filled experience, and I myself participated in many contests, and Phoenix was indeed a great outlet for us from our busy schedule online classes. So we are looking forward for more and more events like this again. Thank you.
Thank you, Dr. Maya, for the wonderful feedback. Up next, we have Professor Dr. M.S. Balakrishna, sir. Sir, you can unmute yourself and give us a feedback, sir.
Yes, good evening, everyone. Dr. Joe, am I audible?
You're loud and clear, sir.
Okay. Good evening, everyone. This is Dr. Balakrishna here, Professor and Head, Department of Oral and Maxillofacial Surgery, Malabar Dental College. First and foremost, I feel greatly honored and overwhelmed to speak at this platform. I would like to congratulate the entire team of Phoenix 2021 for a wonderful conference, which is loaded with fun, entertainment, excitement, a visual treat, and it was indeed a scientific bonanza. I was wondering in the beginning of the conference, a conference for 10 days, what will the organizers do to keep the delegates actively involved for a period of 10 days? But I was overwhelmed to see such beautiful, innovative, and exceptional ideas. Apart from scientific sessions, there were quiz, collages, throwback pics. So it really pumped up the delegates, and I could see a tremendous participation from each and every delegate. I would like to congratulate the organizers for selecting so many different kinds of guest speakers on different topics. So it was full of entertainment and loaded with knowledge. More than 4,000 registration speaks volumes for the IAPHD Kerala chapter. So this conference reached to each and every college in India, not only India, neighboring countries, Middle East, and even to United States of America. Some of my friends who have done DDS and working there, they got the brochures and contacted me that I was one of the speakers. So it has reached everywhere. Because of huge registration, I suggest the organizers to go for a Limca Book of Records for conducting a huge conference for 10 days and more than 4,000 delegates. So CV sir, I don't know the records of previous thing, but I suggest the entire team to go for Limca Book of Records. So this Phoenix 2021 has given a great platform, not for only postgraduate students, but for entire BDS community. Starting from students from first BDS to second BDS to house surgeons, postgraduate students, staffs, and even the practitioners. So I congratulate for this innovative idea of the organizers and thank especially Dr. CV for such a wonderful event. So in our country, India, Navaratri is held for 9 days. Kumbh Mela is for 12 days. And this Phoenix for 10 days is no less than a dental festival, which is loaded with a scientific bonanza. It was a visual treat indeed. Normally, with my experience, the offline traditional conferences, it is very difficult to attend each and every session. It's very difficult to attend each and every guest speaker's lecture. But because all of them are happening at the same time at the different venues in the same campus. But Because of this virtual conference, Phoenix 2021, all the sessions were at our fingertips. We could see at our own will. So kudos to Dr. CV and the entire organizers team. Your team has made such a high benchmark now, which will give a tough time for other conferences to match to. Once again, I thank entire team of Phoenix 2021 for a wonderful show. Thank you.
Thank you, Bala sir. Be it in classroom or in Zoom, it is always a pleasure to listen to you, sir. Now, can we have a quick raise of hands? We can take up 2 more candidates for the feedbacks, and then we can go into the concluding session. Yes. We have Professor Dr. Mohammed Muteret, sir. No, sorry. Up next, we have Dr. Soumya KR. Dr. Soumya KR, you can unmute yourself and give us your feedback.
Yeah.
Please identify yourself first.
Yeah, this is Dr. Soumya, working as Assistant Professor at Government Dental College and Research Institute, Bangalore. At the outset, I would like to thank the organizing committee for organizing such a big conference, Phoenix 2021, that is on the virtual platform. And I thank Dr. CV Pulayat, the organizing chairman, and all the organizing committee members for organizing such a wonderful conference. And it was a wonderful and well-organized conference, and with excellent presentations. I'm sure the delegates have utilized this to the maximum. And it was one of the unique conferences which I have witnessed, or we have witnessed in these days. And with an excellent teamwork, they could actually have more than 4,000 delegates. This is one of the examples where we have utilized the brighter part of the pandemic, what we are facing right now. Once again, best wishes and congratulations to the organizing team. Thank you once again.
Thank you, Dr. Soumya. Dr. Soumya is the editor of Indian Association of Public Industry Head Office. Thank you for being here, ma'am. Thank you very much.
Thank you so much, Dr. CV. Thank you.
Thank you, ma'am. Thank you, sir. Can we have a quick raise of hands at this point so that we can? Yes, we have Dr. Aparna Murli. Dr. Aparna Murli, you can unmute yourself and give us the feedback.
I'm Aparna Murlidharan from Final Year Part 1 from Government Dental College, Kottayam. It was a great educational experience for me. We have definitely learned about many new things through those excellent sessions. I didn't expect this much when I registered for this conference. Even though this was an online conference, it was very systematic and organized. And thank you for all your effort. And thank you for organizing such a wonderful event. Thank you.
Thank you, Doctor. Yes, we have Dr. Mohammed Muteret, sir. Sir, you can unmute yourself and give us a feedback, sir.
Hello. Yeah. Very good evening. Very good evening to all the organizers and all the delegates of the conference and all the guests. I'm Dr. Mehboob Muteret, Professor of Public Health in Qasim University. I was sitting here.
Please carry on, sir. Mohammed, sir, you can continue.
The first meeting, all those memories are coming to us like each and every time. And with our friends and colleagues, we were sharing all the long days and such many more sessions. Actually, what I felt is in this conference, we were taking the IAPHD, the public health industry, exactly to the community through our UGs. Most of the time, the undergraduate students won't be knowing like what is this specialty and what is it. Exactly, we were taking this to them, and we were teaching the undergraduate students what are the possibilities of this specialty, and they have really understood it, I suppose. And one word what I have to say is like a big loud applause to all the organizing team, especially CVB Pulet, the chairman, and his keen interest in conducting this conference. It has to be much appreciated. And one word to say is like if public health industry to the community or to serve the society, there we will succeed definitely. And we're being
There seems to be a technical glitch there. Mohammed Mutairid, sir, if you can hear me, please respond, sir. All right. So thank you, sir, for the session. And next, can we have another candidate? Yes, we have Dr. Sri Lakshmi P. Dr. Sri Lakshmi, you can unmute yourself and give us a feedback about the session. Okay, moving on. We have Dr. Abhisha Femin. Dr. Abhisha Femin, you can unmute yourself and give us your feedback.
Good evening, all. I'm Abhisha Femin from Government Dental College, Kannur. So it was the first time attending a conference like this, that too online. So when our colleges were shut, we were like, okay, dentistry is going to be bad in the future years because our clinics were closed down, our colleges were shut. But after hearing all these speeches, after hearing all this education system about this motivation speeches, so we all are having a hope in the future that we can do better. So even if it is a public health dentistry platform, we could know about our future, how we're going to strive in this dentistry. So thanks to all the doctors out here who worked for us, who spend their time, valuable time for us. So hopefully in the year 2022, we all can meet offline in a bigger platform than this. Thanks to all. Thank you, everyone.
Thank you, doctor. I guess it is 7 and we can wind up. I invite Dr. Sudeep, sir, for the vote of thanks.
Thank you, Dr. Joe. Am I audible?
Loud and clear, sir.
All right. Good evening, everyone. I deem myself very privileged today to propose the vote of thanks on this memorable occasion. It has been a very fascinating and engaging last 9 days during Phoenix 2021, the grand virtual conference of Indian Association of Public Health Industry, Kerala chapter. So indulge me for a couple of minutes because it was not just us few seen here today, but there's a huge team behind the conference who actually were very instrumental to put this conference together and see it through to the very end. Let me first of all start by giving glory to the Almighty God to have blessed us with the chance of coming together in this pandemic time. I would like to extend my gratitude to our chief guest of the day, Honorable Vice Chancellor of Kerala University of Health Sciences, Dr. Mohan Punnamal sir, who despite the busy schedule has found time to address us on this occasion. I must mention our deep sense of appreciation to our guest of honor, Dr. Vamsi Krishna Reddy, General Secretary, IAPHD Head Office, who graced us with his presence here today. I extend our gratitude and special thanks to Dr. Sriram Venkatraman, IAS, Additional Health Secretary, Government of Kerala, for the very informative session on public health in India, changes and challenges. Thank you, sir. Our heartfelt thanks to other dignitaries, Dr. Fuad Odinsho, President, World Medical Association, Germany, Dr. Bipin Gopal, State Nodal Officer, Non-Communicable Disease Control Program, Government of Kerala, Dr. Simon Morrison, Deputy Director of Health Services, Government of Kerala, Dr. Deepu J. Matthews, Secretary, IDEA Kerala State, for being with us and gracing the occasion. I also extend our great gratitude to various stakeholders of public health from Government of Kerala, media partners, executive members of IDA and IAPHD head office. Our very special thanks to all the speakers of the guest lectures during the conference, Dr. M.S. Balakrishna, Dr. Subramaniam, Dr. Mahmood Mutedar, Dr. Joby Peter, Dr. Bindu, Dr. Sendil, Mrs. Smita, Dr. Harish Kumar, Dr. Binu Abraham, Dr. Vivek Narayan, Dr. Pooja Lati, Mr. Sudeep Sebastian, Mr. Sudhir Manon, and Dr. Arun Paul for accepting our invitation and sharing their expertise with us. I extend our sincere thanks and appreciation to all the judges of various contests and awards and to the chairpersons of all our scientific sessions. A special thanks to our sponsors, Colgate and Ortho Creations, and co-host Online Dentistry for all their technical support, especially Dr. Binu Abraham and Dr. Joby Peter, and of course, the technical mastermind without whom the online mode of this conference could not have been this smooth and successful. Thank you, Dr. Cho. Before I go to the very important team that put this conference together, I think what I must say is I have been very, very impressed and touched by the ability and enthusiasm of the delegates. And I think they deserve a huge round of applause. My heartfelt thanks goes out to all 4,300 odd participants. Thank you. I extend my thanks to our President and Organizing Chairman of Phoenix 2021, Dr. C.V. Pulyat, Honorary Treasurer, IAPHD Kerala, Dr. Ebi Alukal, the Scientific Committee headed by Dr. Subramaniam and his team, Dr. Pooja, Dr. Venkatachalam, Dr. Jaslin, the Awards Committee Convener, Dr. Shanavas Palel, and Dr. Deepu, Reception Committee Convener, Dr. Susan Thomas, Programs Committee Convener, Dr. Rajani George, Judging Committee Convener, Dr. Danya Murlidharan, Registration Committee Convener, Dr. Sabin Siddiqui, Events Committee Convener, Dr. Mary Shimi, Social Media Committee Convener, Dr. Diti, Gifts Committee Convener, Dr. Shamas Mohammed, Directory Committee Convener, Dr. Shiraj P. Ismail, and Publicity Committee Convener, Dr. Matthews Baby, for all their hard work and support. Our very special thanks goes out to Dr. Vivek Narayan and his team behind Mind Melds, Kindling Bright Sparks, Virtual Quiz, Dr. Mary, Dr. Bindu, and Dr. Arun, and to all the day coordinators of Phoenix 2021. I also thank all the unnamed yet unforgotten minds behind Phoenix 2021 and all the members of IAPHD and Kerala chapter especially for the support and participation in making this conference a resounding success. Once again, thank you one and all.
Thank you, Dr. Sudhir. It is now time to draw the curtains for the valedictory function. Of course, there's an end to everything, but we believe that there is never an end, but always a beginning. Once again, congratulations to all the winners. This is Dr. Rajani George, your host for today, signing off. Until we meet again, take care and stay safe. Thank you, everyone. We shall now conclude with the national anthem.
Jana Mana Adhinayak Jaya He Bharat Bhagya Vidhata Punjab Sindh Gujarat Maratha Dravida Utkala Vanga Vindhya Himachala Yamuna Ganga Uchala Jaladhi Taranga तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे